Ambulance 7 Boston 211 with you on a 17 Zulu. It's full clear at 1432.
Hi, my name is Josh Kern. I'm a paramedic with Dixie Ambulance in St. George, Utah. And I'm going to be doing a review of the Generation 1 backup pack from Statpacks. And I'm going to change gears here a little bit from the rest of the YouTube videos. You've probably seen about some of their gear that are geared more toward the civilian side of medicine and EMS, and kind of go a little bit on that tactical medicine side of this. So let me tell you a little bit of reason why I'm even qualified to be talking about the tactical side of this. I actually spent 2 years over in Iraq and Afghanistan both doing contract work with the military, and we saw quite a bit of action even though we weren't combat units. And one of the problems that we all had as medics over there was finding a loadout, a kit that we could actually put all of the equipment in that we wanted to without overloading it and without having too little or too much of one thing, and being able to access all of it at one time. And this kit does a really good job of that. And again, this is the Generation 1 backup kit with Statpacks. And let's just go ahead and open it up real quick. You'll see that as we open this up, you've got easy access to probably 90–96% of your kit right here at the opening. Again, it's very modular. One of the things I did with this kit is that a lot of the modules with Statpack come with these Velcro straps right here. And on the inside is a really nice Velcro surface that if I stick things to it, I can flop them out of the way without losing them. And I can also take them off and hand them to people if I need to give medications or IV starting to somebody. It's really nice for easy access. And now, of course, a lot of you know, if you're looking at tactical gear, you're probably tactical medics, and you're going, well, we don't start a lot of IVs in tactical situations. And you're right, we don't start a lot of IVs or give a lot of medications. But keep in mind, this is probably your Charlie kit. This is the bag that you dropped outside of the door before your high-risk entry, or the one that you've got sitting back in your armored vehicle that has all of the equipment that you need beyond your Alpha and your Bravo kits. So you do want to keep your medications in it, and IV access is going to be an issue if you're doing blood replacement and things like that. The medication modules are really nice and compact, and what I like about these is that it is so dense. Everything is packed in it so nice and tight, and I've got a full complement of medications here, going from all of my code medications to pain medications, the fentanyl and the Dilaudid, just all of your code medications that you could possibly need in a traumatic arrest situation with your crew. And you can also stock it with your combat pill packs, your antibiotics, your Cipro, your things like that you're going to give your guys for prophylactic, infection protection. And it all folds in really nice, really compact, syringes, needles, quick code drugs, all your medications. It's got a plethora of pouches and pockets in here, and you guys all know that if we give you space to put stuff, you're going to put stuff in it. You'll find something to fill up the holes with. And but the best thing about it is with all that medication, it's such a nice compact package. It's got the dual zippers we all like, so that you can keep your zippers in one central spot and one quick pull and you're open. And I kind of like the red color even in my tactical kits, because to me it's easy to identify what's going on with it. I'm just going to set this to the side real quick. The next piece I want to talk about is the IV Start Kit pack they've got here. And I don't know if you can tell on the camera here from the top view, but it's got these little pouches on the outside where you can slide all your angio casts that you need to stick in there, whether you're doing 14s, 18s, 20s, 10s, if you want them for needle decompression. Right there on the outside. When you open it up, you've got everything you need right here. You've got your drip sets, your half liter saline bags, or your 250 bags, whatever you're choosing to use on your kit for your guys. You've got space for syringes for medications, and my personal favorite is Curlix, especially in a tactical situation. One of the best things that we do is that there's no place to hang an IV bag. So if you take and start an IV with, say, a 250 bag or a 500 bag, and you co-band that to your operator's arm, they're still able to shoot and move and operate, return fire if they're taking effective fire with TC3. And your IV bag is still under pressure, so you're not going to get blood backfilling into your tubing. That's just one of the things that I like to do, and that's why I have that gear in this loadout kit. Another favorite's a good old IO. And so pretty much everything you need to gain access to for medications or venous access for your patient is right here in this quick little module. And again, with the Velcro straps on the back side of it, it's really easy to stick inside here on the sides and flip out of your way when you don't need it, but it keeps it contained. It's not, your kit's not spread out all over the ground. Go ahead and set that off to the side. The rest of the stuff that I've got in here is pretty much not really field EMS oriented. It's geared more towards, like I said, hemorrhage control, you know, the TC3, the Tactical Combat Casualty Care protocols, where you've got bleeding control, splinting, a BVM for airway devices, an ENT kit. I'm not sure if you guys are familiar with that. It's an ENT kit, so you can do some checking out of your patient, some more detailed assessments for you 18 deltas and stuff out there if you want to do that. Tourniquets, Curlix, and elastic bandages. And these are one that I think they get underused, but you can put a lot of these in your kit here. And I'll be honest with you guys, when I took my my personal kit, and this is actually a lot of my gear, and was loading up this bag, I had trouble filling this bag with all the gear that I normally carry in my loadout. It's got so much room, and one of the neatest things about it, this is an airway module, and I'll get to this here in a second. One of the neatest things about this kit is that whenever you pull everything out, you'll get a good view of it. All these SAM splints. Is that you'll notice the interior is made up of these dividers. And if any of you guys have ever seen a camera bag or used a camera bag, you'll know that you want to have different places for all your lenses and things like that. Well, the Statpacks took that same concept and applied it to a medical kit bag. So that if, for example, I wanted to put the airway bag up here, it's really easy for me to pop out these dividers and reconfigure my bag. And put the airway kit up here. It's extremely modular. It's one of the things that I really liked about this bag. If you really wanted to, and I mean, if it's a really kitchen sink bag and you want to put everything into it, you can reconfigure these panels. And if you really wanted to, I mean, this is a regular full-size oxygen tank. It fits right in there perfectly with the regulator even. And you still have a lot of room for a lot of your quick access gear that you need to have that you don't have in your Bravo and Alpha packs. I'll be honest with you guys, this is probably the most versatile pack that I've seen out of any medical pack that I've used, and I've looked at a lot of them. Just because of its ability to change and adapt to your missions. If you are looking for a kitchen sink bag that you can have sitting outside doing your high-risk entry, or sitting in your squad vehicle, or sitting in your tactical van, that you need to have everything, this is a great bag for that.
Sierra Tango Alpha Tango Papa Alpha Charlie Kilo Sierra, back in service.